If the body is isolated parts, symptoms are broken pieces to remove. But observed as a deeply interconnected system, symptoms signal a deeper internal disturbance. When Samuel Hahnemann wrote The Organon of Medicine, he began with the introduction chapter, a rigorous academic and philosophical critique of the dominant medical practices of the 19th century. To evaluate his argument, we look at the old-school material view of disease. Historically, physicians believed illness was a physical object, a corrupt fluid, a localized structural defect, or a specific localized toxin. Operating on that assumption led to aggressive interventions. If the disease is physical material, the logical step is to extract it. This meant utilizing depletion and evacuation tactics, purging the body or applying leeches to physically drain the illness away. Practitioners also relied on complex drugging. They routinely mixed multiple active, often toxic substances into a single prescription, which made it impossible to determine which specific ingredient was actually affecting the patient. When medicine reduces disease to a hostile physical object, the treatment focuses on forceful removal. This keeps the clinical gaze locked on the localized target, rather than the systemic impact on the living organism. Hahnemann countered this material approach with an alternative framework, the dynamic view of disease. In this context, dynamic refers to a functional, living disturbance within the whole organism. It is a systemic imbalance that exists before any visible structural damage occurs. In the dynamic model, local symptoms, like a skin eruption, are not the disease itself. They are the outward expressions of an internal, whole-body imbalance. Hahnemann used the term allopathy to describe the historical practice of treating these outward symptoms with direct opposites to force them into submission. It is important to maintain academic precision here. Terms like old school and allopathy refer specifically to 19th century speculative theories and interventions, and certainly not modern, evidence-based conventional medicine. Hahnemann's critique shifts the focus away from the isolated local lesion and toward the functional harmony of the entire living patient. Hahnemann rejected the material approach because of a specific recurring pattern, temporary relief followed by a relapse. This flowchart maps the logic of that historical approach. It starts by identifying a local visible symptom and assumes a physical cause, attacking the symptom with an opposing drug for rapid palliation. This creates the primary action, the direct, immediate physiological effect of the drug suppressing the symptom. But after the drug's initial effect wears off, the organism mounts a vital reaction. Hahnemann termed this the after-action, or secondary reaction. When we follow this path to the clinical outcome, the reason for the failure becomes clear. The opposed symptom often returns stronger than before the treatment began. Relying on direct opposition provides temporary relief during the primary action, but it risks a worsening of the condition once the organism reacts. If disease is a systemic dynamic disturbance, then a generic diagnostic label is an insufficient guide for treatment. The material view treats a single diagnosis, like tension headache, identically. Homeopathy maps symptom totality. Patient A has throbbing right-sided pain, worse in heat, desiring cold, and high irritability. Patient B has pressing frontal pain, triggered by mental work, feels chilly, and is highly anxious. These distinctions are modalities, the specific factors that make a patient's symptoms better or worse. Because their dynamic expressions are unique, their clinical interventions must be equally distinct. Homeopathic individualization requires mapping the unique physical, general, and emotional expressions of the whole person to find a matching remedy pattern. Consider a 34-year-old with chronic heartburn. Taking daily antacids provides an hour of relief, but pain returns stronger every evening. Neutralizing acid is treating by direct opposition. This follows the after-action pattern. The symptom returns at a higher intensity once the primary action subsides. Prescribing for the generic label heartburn fails the individual. We build symptom totality by extracting modalities, pain linked to stress and relieved by warm water. Finally, we incorporate generals and mentals, adding his chilly sensations and bedtime anxiety to complete the picture. Synthesizing these modalities, generals, and mental states allows a practitioner to address the dynamic disturbance underlying the physical symptom. Hahnemann's introduction chapter was designed to replace abstract speculative theories with a practice built on observable clinical results. The material view focuses on the physical lesion to oppose or suppress the visible symptom. The dynamic view recognizes a whole system disturbance and matches a remedy to the precise totality of the patient's symptoms. This shifts the definition of cure from erasing a local physical sign to restoring overall biological order. Understanding this philosophical contrast is the prerequisite to accurate clinical history taking and effective remedy selection. Embracing this historical philosophy must never compromise modern patient safety. There are strict professional parameters. Never advise a patient to stop their prescribed conventional medications, and never skip necessary diagnostic tests. Practitioners have an ethical duty to identify clinical red flags. Structural emergencies and severe infections require immediate medical referral. Communication with patients should be ethical and clear, focusing on supportive care without attacking modern healthcare systems. Mastering the Organon means treating the dynamic totality of the whole patient while upholding the highest standards of safety, ethics, and professional boundaries.